our lecture number 2 on the strategic management module. On this particular lecture, we will be focusing on external analysis in healthcare. Simply, we will seeking to understand the healthcare environment, especially focusing on the external environment and its impacts on healthcare organizations in general. So we are beginning to say that external environment in healthcare is going to refer to various factors that are outside the organization. And these factors will definitely influence how the organization performs and various outcomes that are contributed by these factors. And we will also note that it is a very complex environment. It is a dynamic, it is uncertain. We are not really sure what is likely to happen. And this particular environment will require constant monitoring and analysis by healthcare organizations. Examples of the external environments, though we will also discuss them in the next few slides, we could just think about regulatory environment as one of the external environments. And these will refer to the environment around government regulations and policies. We could have, for example, policies on patients' rights. We could have policies on healthcare delivery models. We could have policies on quality standards. These are things that are not controlled from within the organization. If government sets policies on patient rights, then all external organizations or healthcare organizations are supposed to adhere and abide by them. And also other examples of external environments could also be around technology in healthcare. It could also be economic environment where we discuss matters, inflation, matters, taxation, and so on and so forth, all revolving around healthcare organizations. And we could have external environment also in relation to public health issues, crises like happened during COVID-19, natural disasters, and so on and so forth. So this, by the study of this environment, then we will now be able to understand how we can be able to organize ourselves as healthcare organizations and how we can deal with this environment, that it does not as healthcare organizations. So we have a number, when we talk about levels of healthcare environment, we have the general environment, where we are going to be looking at the societal conditions that are going to affect all organizations, political, I've just mentioned a number of political factors. The issue about regulation is also related to political factors in terms of the governments, because the governments are key in terms of creating and implementing health policies. And government, political, also in the aspects of government, government is also very key in terms of funding healthcare activities. And political decisions also can affect the availability of healthcare services. We also have economic aspects, social cultural issues, religion, beliefs of the community that we intend to serve, technological issues, environmental and legal factors. When you talk about legal factors, for example, it could be around licensing, licensing boards that are supposed to oversee healthcare activities, and also we could have public health laws that are meant to be enforced for us as healthcare organizations to be operating in the right environment. And then also another level of environment in healthcare is the task environment, which is going to be consisting of specific entities and groups that we are going to be interacting with. And these groups will have a direct impact on the healthcare organization. For example, the customers, who could also refer to as the patients, the competitors, the competitors. These are the organizations that we are competing with in offering healthcare services. The suppliers, this could include medical suppliers or medical product suppliers, regulators, for example, the government, various partners, and all the stakeholders in general. So now we discuss the aspects of external analysis in healthcare, and we are saying external analysis in healthcare is very, very critical. And we are going to be seeing a number of tools that we use. So when we are doing external analysis, it's simply the process where we are going to be examining external factors that affect the healthcare organization performance, such as political, social, technological, environmental, and legal factors. I have been able to give examples of some of these factors in the previous slide, and I'm sure also as we continue with the session, you will also be able to interact with these examples going forward. Now, why do we need as healthcare organizations to do external analysis? Or why do we need to study the external environment of the healthcare? Number one, we want to be able to identify the opportunities and threats in the external environment. We are going to be seeing the tools and methods that we use. Through the use of those methods, for example, for point number one, we could relate it to what we call SWOT analysis, where we have the strengths, the weaknesses, the opportunities, and the threats. So once we do external environmental analysis, we could be able to identify the opportunities that lie ahead of us as a healthcare organization. We could be able to identify the threats, for example, threats contributed by competition, threats contributed by challenges in the medical supply chain that we are not able to access drugs, and so on and so forth. It is also important because external analysis will help us align our strategies and goals with external demands and expectations. We have stakeholder expectations. If we are serving patients, for example, we have them having expectations on us as the healthcare organization. We have expectations of stakeholders like government, which is very, very crucial. And therefore, when we look at the external environment, I just mentioned government, for example, in terms of development of healthcare policies. Then we are able now to align those healthcare policies with the general goals of the healthcare organization. And number three, another importance of external analysis is through it, we will be able to adapt to changing needs and preferences of stakeholders. Every day, things are changing around the healthcare sector. It could be, for example, in terms of technology, we have improvements in terms of technology that we are using. It could be advancement in medical supplies, and therefore we cannot just afford to be rigid once we do external analysis, because the stakeholders are expecting us to change with the changing technological season and other changes within the external environment. And these stakeholders that are expecting us to change are patients, employees, regulators, whom we gave example of the government, competitors, and various partners that we are having within our organization. And also in terms of importance, the other one, once we study the external analysis environment in healthcare, we are able to enhance competitive advantage and sustainability in healthcare market. So competitive advantage means once we carry out external analysis, then we are going to note on areas of improvement, and we are able to improve and become better compared to other healthcare organizations that are around us or are our competitors. Now, we need to look at the goals of external analysis in healthcare. Why do we need to do external analysis? Why do we need to study the external environment as healthcare organizations? Number one, we need to understand the current and future trends in the healthcare industry and their implications for the organization. So we want to look at currently where do we find ourselves as organizations, and also future trends is in terms of where we are heading. For example, in terms of technology, we have now adopted telehealth and telemedicine ways of working, and these ones will allow us to do consultation with various healthcare providers. So this is important to be able to note and be able to improve on. And also external analysis is very, very important because we are able to assess the competitive position and performance of the organization in relation to our peers. Our peers, or peers in the language of competition, are those people that we are in the same industry, offering same services. So once we do external analysis, then we are able to know as a healthcare organization, where do we stand to be able to offer the services? Are we better than our competitors, or we are not strategically placed to be able to offer these services? The other one is we are doing external analysis so that we can identify potential partners, potential collaborators, customers, stakeholders that can be able to support and challenge the organization's missions and vision. We did mention the aspect of mission and vision on our first lecture. So through external analysis, then we will be able to understand where can we bring our potential partners, in which areas can we be able to collaborate and be able to serve our patients and clients in a better way. And then also we need to be able to anticipate legal, regulatory, ethical, social, and political issues that may impact on the organization's operations and reputation. So external analysis is simply to say that it is very key. We cannot be able to avoid it because through it we can get to know those external factors that we did mention as we were starting, that are going to affect how the organization runs. Now, when we are doing external analysis as organizations, we have a number of challenges that we are going to face. Number one is difficult in obtaining accurate and reliable and timely data from various sources. Remember, when we are doing external analysis, we will depend on information from that is not with us and that is external. Maybe we are sending teams to be able to get this information. So it may be difficult for us to ascertain the accuracy, to know whether this information is reliable. Sometimes we want to engage the stakeholders in the name of communities, maybe to fill in some questionnaires, and they are going to take time to give us information, or they will give information that is insufficient based on the kind of questions that we have developed for them. And that poses a threat for any organization, healthcare organization, that is doing external analysis. And then also another limitation is the complexity and uncertainty of external environment and its dynamic changes. So the external environment is complex. Over and over, things are changing. Technology is changing, governments are changing, the legal issues around licensing are changing, and therefore things can never be the same. We cannot say that we did external analysis in January 2023 and now we are never going to do it again. The external environment is the external environment is changing. And then we have uh, we have the challenge of balancing various opportunities and threats, and our ability also to be able to prioritize relevant and significant ones. If we have opportunities that we need to explore as an external organization, we may not go ahead and explore all of them at once. Maybe it's in terms of diversification. So we could have that challenge of inability to explore all opportunities at once. And once we get to understand our threats as an organization, it may be difficult to deal with all these threats all at once. Some will require us to put in money. We may not have the budget for that, and then it is going to affect how the organization continues to run. And then also we have the challenge of us overestimating or underestimating the impact of external factors on the organizational performance. Sometimes we will look at the external factors, like I talked about technology, government, legal factors, and we underestimate maybe the impact of some threats that we saw. Maybe it is once we did external analysis in relation to competition or our competitors, we underestimated what something they had implemented could affect us. And then it goes ahead to even affect us very more. It could contribute to us losing some clients, some patients, and that definitely would it is going to lead to a decrease in the levels of income that we generate as external organizations or healthcare organizations. Now, we have the influence of various organizations on healthcare delivery. How do these organizations affect healthcare delivery? Number one is in relation to government agencies and healthcare and regulators. Remember, these ones, they are very key in terms of setting the rules, the standards, the policies. I had mentioned about that when we talked about the political environment. And therefore, we cannot afford to ignore this particular organization, the government. We also have another very key organizations, the professional associations, and accrediting bodies that establish guidelines and best practices. Once we have these professional bodies, and every country has these professional bodies in health. Internationally, in America, maybe we could think about what we call the American Medical Association. This is the largest association of physicians. So it could be a requirement that if you are a physician, you need to be registered with an accrediting body. That is what happens in the law industry. That is what happens in the accounting industry. We have accrediting bodies and regulators, professional associations, that if you are a member of any of that, you need to be registered as part of the requirements for you to be able to offer whatever service. And in this context, offer any healthcare related services. And also other organizations are payers and insurance that determine reimbursement rates. That tells you on the need for us to collaborate with the insurance sector in terms of them assisting to meet the cost of our patients and our customers. Very, very importantly, the fourth one and very key organizations are the suppliers and vendors or vendors. These are very key in terms of inputs. Inputs are the things that we need to be able to put into our organization. It could be drugs, it could be some form of raw materials. Maybe we are in the health sector in terms of manufacturing of a particular product, so we need inputs in the name of raw materials, other resources and technology for healthcare delivery. If we are using certain kinds of technology, then we need the suppliers and vendors become key organizations that we have to rely on for them to deliver to us very efficient machines, for them to deliver to us machines that are also going to be cost effective in terms of service delivery and so on and so forth. And finally, very key organizations in healthcare delivery. It is also competitors, collaborators that are going to offer alternative or complementary healthcare solutions and products in the general environment that is affecting healthcare. Trends are emerging issues that are around healthcare, and these issues are related to the environment. Number one, for example, integration of advanced technologies such as telemedicine, artificial intelligence, and electronic records. That is the changing world in terms of technology now. For telemedicine, it is now allowing us to do consultations from whatever part of the world that we are in. We just need to connect with consultants virtually for this particular service. We also have the challenge, or in our trends, aging population and changing demographics. So we have increased numbers of people that are aging. Of course, you know that comes with challenges in matters health. That is very, very difficult for that group of people. And therefore, we need to know how to handle that particular group of people. Other trends would revolve around policy and regulatory frameworks. Like I said, these ones are going to be changing based on what government is in place. Every government have their own thoughts around healthcare. Different proposals would come about in terms of insurance, government-sponsored insurance, and so on and so forth. So it is that means as healthcare organizations, then we need to be aware in terms of trends in relation to policies and regulatory frames so that we can align ourselves to those policies and be able to meet our goals and objectives. And we have also a key focus now on preventive care, wellness, the ability to be able to address public health issues. I did mention them around pandemics, around natural disasters. Those are things that are now emerging, and we have to know as healthcare organizations how we are supposed to address them. We also have the aspect of growing patient empowerment, demand for specialized personalized care. Now, patient empowerment. Now we are now in a situation where healthcare organizations are doing a lot of patient education and health literacy programs. They are also doing programs around chronic disease and self-management. And they are also running patient advocacy programs so that patients could be aware of their challenges and how they could handle them. For example, revolving around non-communicable diseases. Other trends are escalating healthcare costs and efforts to contain expenses. That one is a major issue. The cost of treatment nowadays has become very expensive, especially in developing countries. And therefore, we need to know how we can be able to resolve that. And that's where governments in developing countries are having conversations around universal healthcare, that they want to improve on the accessibility of healthcare to everyone. In terms of costs, maybe they have national insurance programs that everybody could enroll that is a bit cheap compared to the private insurance services. And a major trend as we wind up this particular slide is the shortage of healthcare professionals. that has become a very difficult situation. If you go to some developed countries and maybe you ask professionals for a particular medical issue, you realize there are some that even don't have one person, and therefore they rely on consultants who have to travel to that country, or they do telemedicine kind of an engagement. And therefore it is something that governments need to invest in terms of healthcare education, and supporting also those that are within the system to be able to further their education and become consultants and assist in healthcare delivery. The reason why we have the issue that I was mentioning on people traveling to India and other developed countries could also be in relation to healthcare professionals. And of course, most people that are going there have also received recommendations from local health facilities that these we may not handle, so we are sending you to another facility, maybe in another country. That could be as a result of social shortages in healthcare professionals. Other trends in the healthcare system would be revolving around quality and safety improvement, where we need to do evidence-based practice. We need to have what we call patient-centered care and infection control where possible. It is also now a current trend where we have a lot of patient engagements and empowerment, where we practice shared decision making. Patient portals, those are just websites where patients could be able to get information. Healthcare has also moved into the social media. We gave examples of organizations that are providing information via social media, and this information is educative. People are able to ask questions and get responses from social media handles of healthcare organizations. And finally, on the trends is in matters diversity and inclusion, where we bring the aspects of cultural competence, health equity, workforce diversity, where we need to have a different qualified workforce or healthcare promotions or healthcare employees, so that we can be able to push our services to the next level. Now we have trends in the service area and their effects on healthcare. When you talk about service area, it's all about the geographical region or community that a healthcare organization serves. And when you talk about these trends in the service area, they are going to affect how healthcare is delivered, and they are going to influence healthcare needs. They are going to have influences on different populations. And therefore, when we look at trends in the service area, we will focus on the market size and the growth potential. So the population size, what is the population size of the community that we are serving, density and the growth rate of the population. We could also look at market segmentation and differentiation. Who are our target groups? We could also look at them on the aspect of their age groups, on the aspect of their income levels, on the aspect of their health needs. And finally, we could also look at market demand and utilization. What is the prevalence of a particular disease in terms of accessibility to healthcare? Is it possible? And what are our consumer preferences or patients' preferences in terms of treatment, in terms of medical care, and so on and so forth. Other trends would be in relation to market supply and capacity. Yes. Such, for example, how many healthcare providers are within a particular locality? What are the levels of facilities that these healthcare providers have? and also the number of beds. Remember, we have the aspect of patients admission, and we do not want to have a scenario where employee or patients are sharing beds. So that's why when you hear the development of any hospital, you will not fail to hear in terms of bed capacity. How many beds will that facility have? And also on matters market competition and positioning, such as market share. Market share is simply a percentage of the market that we are controlling as an healthcare organization. It could be 70% if we are at the top and we are beating or we are unable to, or we are competing with other people. So what is the percentage of the other players within the industry? What is the aspect of the reputation? Remember, we had a discussion around reputation management. How do people perceive us as an healthcare organization? And also the formation of strategic alliances. This is in relation to collaborations that we have with the government, with non-governmental organizations, and so on and so forth. So that is a major consideration in terms of various strengths. Now, remember, our discussion is around the external environment when we are doing healthcare analysis. So for us to be able to get understanding of the external environment, then we need information. And where do we get this information? We can get it from government agencies and databases. We can get it from professional associations. That's very, very important. Also, we can also get valuable information from academic institutions and research centers. Maybe a certain research around healthcare matters has been done, and we feel that the findings would be able to assist us as an healthcare organization. Then we could seek to understand these findings and see how we can incorporate them into making our healthcare organization a better place. And then also we could have information from industry reports and surveys. For example, we could get surveys from the WHO. These organization will always provide World Health Statistics reports. Maybe those reports would be key for us to come up with certain policies as a healthcare organization. And also we could have reports from the World Bank health sector, where they are going to give reviews in matters health from various countries. And finally, we can also get information from media outlets. Maybe the media has gone into the field and see the prevalence of a particular disease. And then from that report, we can use it to develop and provide solutions to that particular community. And also, there's the aspect of social media platforms that I've just mentioned. Now, when you are doing environmental analysis, then we have a number of techniques that we can be able to adopt. And these ones are techniques, for example, what we call the PESTEL analysis. PESTEL is an abbreviation for political, economic, social, technological, environmental, and legal factors. So we are looking at the external environment. On the political perspective, I gave examples on what kind of government we have in place. We could also have external environment on the aspect of economic environment. How will that impact us as an organization? So we need to be keen to understand how PESTEL analysis works. Social is to deal with people within a particular community. So what are their cultural beliefs in terms of healthcare? Are they people that need to seek medical attention, or there are those that believe they cannot be able to seek medical attention? all those external issues will affect how our organization operates and how it is able to move forward. Then we have SWOT analysis. I'm sure these ones are clarified in the other slides. I had also mentioned about it. We could assess our strengths as an healthcare organization, our weaknesses, our opportunities, and our threats. And once we do that, we could also perform what we call stakeholder analysis, where we are going to analyze our stakeholders. Stakeholders, I said, are people that are interested in matters healthcare or in matters healthcare organizations. For example, within a community, we would seek to understand their needs. We would also seek to understand their expectations. We would also seek to understand the interests of various groups that are involved, and so on and so forth. And then finally, we could use a technique we call the Porter's 5-force model, which we will be discussing in the next few slides. So the PESTEL framework is what we had looked at as number one. So this one will analyze the macro environment factors, the external factors. For example, the political factors. We have had discussions around these ones. Government policies, what are the regulations around healthcare, stability, influence in healthcare delivery. And on the economic front, we could look at the market conditions in terms of pricing, for example, for medical care, pricing for drugs. Economically, we could also assess the level of competition. We could study consumer behavior and see how it is going to affect healthcare demand and supply. For example, in relation to people's income. When people have low income, definitely that is going to hinder their accessibility to quality healthcare. So as healthcare organizations, we need to be conversant with that, and so that we can be able to work on improving and see what we can be able to do so that we solve that particular problem. This is a continuation of the PESTEL framework also. So the social factors, I did say social factors are related to people. So we will look at the demographic trends. Demography is all about population. We will look at the birth rates within a particular population. We would look at their levels of income, cultural values and beliefs, their level of health literacy. That's very, very important in order to be able to assist us now to formulate programs for them. Maybe they are not conversant on matters management of chronic diseases. So we could provide solutions by taking this education to them to enable them understand. On the technological front, as we are doing PESTEL analysis or using this framework to analyze the environment, we could look at the levels of innovation in terms of digitization. Have we moved to the level where, as an organization, we have digitized our services, automation of our services, and so on and so forth? And we have the environmental factors, issues around climate change. That is a conversation that we are having now very many times. Issues around population, how are they going to, or pollution, how are they going to affect how, as healthcare organizations, we offer our services. Issues around natural disasters and their impacts. And finally is on the legal factors, where we analyze in terms of the laws, in terms of ethics, in terms of our ability to be able to comply with various requirements and meet various regulations within there that are provided by the government. Now we have a number of techniques that we are going also to use when we are doing external trends in healthcare. For example, we have a technique we call the use of scenario planning. So when we are using the scenario planning, we seek to develop possible futures on how things in the future might affect the health sector. For example, we can do that by identifying key health trends and uncertainties. Then we can use that particular information to plan ahead, that in case a particular scenario that we were looking at happens, for example, the scenario of COVID-19, every country in the world knows now there could become a pandemic here that could almost stall all our activities. So they need to plan ahead and always be ready for such kind of eventualities. And also, we could also use the Porter's 5-force model to analyze the competitive forces and their attractiveness. We are going to discuss that in one of the slides. And also, we are going to use what we call trend analysis. In this one, we will use it to identify and monitor key drivers of health and some of the indicators of change in the health sector. When we are saying that the health sector has changed, what comes into our minds? Maybe we could talk about a reduction in deaths within a particular community. Then we would say something has changed because of the services that we are offering as an healthcare organization. Now we have what we call the Porter's 5-force model. And this tool is very important in terms of analyzing competitive forces in the healthcare. So this model is developed by, or was developed by somebody we call Michael Porter. In simply for him, he was having discussions around competitive forces in the healthcare industry. And he talked about, number one, industry rivalry in terms of the number, in terms of the size of organizations, in terms of the strategies that competitors are having that is going to impact the levels of communities and their lives. He also talked about threat to new entrants, that in the health sector, we could have things that are going to limit us from having new players come on board. And those could be, for example, barriers to entry. Barriers to entry would mean things like regulatory and licensing requirements. Maybe it could be very costly for somebody to just come out of nowhere and set up a healthcare organization because of that. It could be high costs that are involved in setting up healthcare organizations. And it could also involve the market share and incumbent providers. When you want to set up an healthcare organization, of course, you know there are those that are already in the market, and you have to work extra smart so that you can be able to defeat or provide better services in a better way compared to them that have been existent for a long time. We have what we call economies of scale. Economies of scale are simply the benefits that as an healthcare organization you are going to enjoy because you are a large organization. For example, things to do with discounts. Because if it is in terms of medical supplies, then you are buying them in terms of millions of dollars. That would be different for somebody who is just starting a very small healthcare organization. They cannot enjoy those benefits, what you are calling economies of scale, because they are just a small organization. And also, threats to new entrants would be brand loyalty. You would be getting into a market that people are already loyal to a particular brand, or a particular brand of drugs, a particular brand of healthcare facilities that they prefer to be served. And that becomes difficult for you as a new entrant in that particular market. And of course, issues to do with healthcare competition. That is also an area that is growing. Now, Porter also talked about the threats to substitutes. How is the availability and affordability and quality of alternative healthcare solutions. That is a major issue. And also, he also talked about the bargaining power of suppliers. What is the concentration of the suppliers available? Differentiation, that is in terms of the uniqueness of the goods or inputs that they are supplying to us. Switching cost of healthcare inputs. I could be using a particular drug, and then a new player as a new healthcare organization comes on board. And for me to be able to switch from what I have been using to another kind of a drug, it could be very, very expensive for me to do so. So I will prefer to stick to the company that provides me with particular drugs, or the healthcare organization that provides me with a particular health treatment. And also, finally, Porter discussed about what we call the bargaining power of buyers. How is the diversity of the clientele that we are serving, their influence in healthcare customers drive, and also the level of satisfaction that they are enjoying from existing organizations. And then we have the framework of SWOT analysis in external analysis healthcare. I had mentioned about this. We think about the strengths, the weaknesses of an healthcare organization. So once we do this, we can now be able to know on how we do in terms of opportunities and so on and so forth. What advantages are we going to take in terms of threats? What is it that we are going to do as an healthcare organization so that we can be able to deal with possible threats? As we wind up, some of the examples of opportunities and threats in healthcare. When we talk about opportunities, we could be having increasing demand for health services. So that means there are things that we can do so that we can take advantage of this increasing demand. And also, we could be having improvements in technological innovations and new markets. And in terms of threats, we could have issues around rising costs, regulatory changes that is contributed by different government setups that are coming into leadership. And also we could have threats to competition and threats to various pandemics. And finally, we are going to have a number of techniques that we are going to be using or to access or to assess external events. We could use, for example, number one, risk analysis that is going to assist us identify and evaluate potential threats. We could also use impact analysis to assist us understand the effects and implications of external events that might occur, and that these events might affect us in one way or another. And finally, we could do contingency planning. And when you are doing contingency planning, it is going to help us safeguard patients' care, protect staff, and maintain levels of integrity. And finally, we could also be able to initiate strategic thinking through where we are going to be asking different questions. For example, we can ask ourselves in terms of population, in terms of what is the population in our area of jurisdiction. We could also ask questions in terms of what are the emerging healthcare technologies that are coming up, and are they technologies that we would want to adopt. So that is the discussion around the external environment of healthcare. Maybe if there is any question. So we are going to call it a day. Mr. Samuel.